Thank you for joining, everyone, and thank you for your time. My name is Zareen Damasia. I'm a physiotherapist working at Mediclinic City Hospital. I work in the outpatient department at City Hospital. Today's presentation is about yoga and more on the medical side and the benefits of yoga. And it may, at this point, you may think that, you're going to hear quite a dry presentation, but I hope after this 15 to 20 minute short presentation, you'll be able to understand more the physiological benefits of yoga on a biological and physiological level. So we'll just go ahead and go over some common myths that people have about yoga and some of the barriers that people face about yoga. And these are the things that make them a little bit apprehensive to start yoga if they have never started it before. So one of the common things that people, they report to me, they say that I'm not flexible, so I can't do yoga. And this is a very, very common misconception that people have. Flexibility is something you will gain only if you start yoga. You don't need to be flexible in order to do yoga. This is another barrier that a lot of men face. And they say yoga is, we mostly go to a class, you see mostly women are there in the class. Doesn't make them feel quite comfortable to join a class where they may be outnumbered. But traditionally, yoga was actually practiced only by men, and over time, due to changes in the way our societies are, changes in demands that our society has put forward, women just have had more time over with our our recent demands of our day-to-day life. Women have been able to practice yoga a lot more, and the men haven't had a chance to participate in just today's modern society. The next one is yoga is for fit. This goes along with the first one, is that fitness is something that you will be able to gain only if you participate in yoga and not a prerequisite. And again, a lot of people think yoga is just sitting around and it's a bit of stretching, it's breathing, it's lying around, doing shavasana, meditating, and it's not a good workout because they really feel that, if I go to a yoga class, I want to sweat, I want to have a good workout as such. Now, there are different styles of yoga. So, that's the whole point about going for a good teacher and a good facility where you can be, the yoga sessions and the yoga postures and styles can be individualized for the particular person and for their needs. This one, as a physiotherapist, I get this a lot, where patients say that, I've not been doing yoga for a long time because I just have been in so much pain. So pain is one of the things where people have, again, a misconception where they feel that if they are in pain, they should not be moving, leave alone yoga, they should not be participating in any activity. And this is the common misconception that people have about pain. So pain is, of course, an unpleasant event. It's not nice to experience. However, pain is not necessarily related to a current injury. You can have pain even when your injury has healed. Because pain, now we know in modern neuroscience that pain is a process of the brain. So your brain is what decides how you are feeling. So this is certainly not the case. If you are in pain, you can certainly practice yoga. However, there could be certain postures that need to be modified. One of the main benefits of yoga is soothing the nervous system. So our nervous system, we have many parts of our nervous system, and one of the main parts that get targeted with yoga is our autonomic nervous system, which is a part of our nervous system that regulates our stress response. So we've got two parts of our nervous system, our sympathetic and our parasympathetic system, one which responds and regulates our stress response, and the other parasympathetic system, which calms us down after a stressful event. So yoga is really good because it really stimulates that parasympathetic system, which should be the part of your nervous system that gets activated when a stress response has been completed. So in a stressful situation, your sympathetic system gets activated, and then your parasympathetic system kicks in to calm you down. However, in our modern life, where we have a lot of stress, ongoing stress, a lot of deadlines, our parasympathetic system stays in a way inhibited. It's there, but it really doesn't know how it should be behaving. So yoga is a really good way to stimulate that parasympathetic system. It's, in my opinion, it's a moving meditation. Meditation is, again, one of those things which is, we know that our parasympathetic system gets stimulated. It's a way to focus our attention on something, and yoga is a wonderful way to do that because you are focusing on your postures, and in the same way you are not only moving, but you're also meditating at the same time. Now, another benefit of yoga is breathing, and it's the breath with the movement. And this is a question that I get all the time, is that if we are breathing all the time, we breathe to stay alive, why is focusing on breath so important? Why do we have to practice breathing? And pranayama, which is your nasal breathing, which is a breathing technique that is practiced in yoga, why do we need to do this as a practice? So conscious breathing is very different from unconscious breathing. Conscious breathing is you use a different part of your brain. Unconscious breathing is what we do just to stay alive. So practicing something as a conscious effort is very important because you can refine it and make your body practice this event so that it becomes unconscious. So nasal breathing specifically is very, very important. Now, a lot of people tend to breathe either very shallow or they tend to breathe through the mouth. But nasal breathing is really important for our body because it increases the production of a gas called nitric oxide, which is an anti-inflammatory gas, which coincidentally during COVID, they were actually giving a lot of patients that were recovering from COVID and having respiratory issues, they were actually giving people nitric oxide. So this is really interesting that our bodies produce nitric oxide. We ourselves, with nasal breathing, with the oscillations of certain structures in our nasal cavity, we produce nitric oxide, and we ourselves can produce it with these simple breathing techniques. So it's again something really simple to do with so many good benefits. So nasal breathing increases production of nitric oxide, and interestingly, humming, which is also a technique which is practiced in yoga, apparently increases the production of nitric oxide by 15-fold. So these are just interesting facts to consider when considering practicing breathing as a technique. And as we said, yoga increases the parasympathetic activity. Now, another concept about that, which I would really like to bring forward today, is heart rate variability. Now, heart rate variability is an objective measure that we can all use to improve our breathing practice. Now, what is heart rate variability? I'll be able to explain in a bit. So we'll just go to the next slide. Just bring this up here. So imagine that your heart rate is 60 beats in a minute. So imagine that your heart rate is beating at 1 beat a second, but in reality, our heart doesn't beat equally at each second. It doesn't beat at an equal interval. So sometimes it may beat at 1.2 seconds, sometimes it may be 0.9 seconds or 0.8 or 1.12. So overall, over a minute, yes, your heart rate may be 60 beats a second, but the rate is not at an equal distance. So what we need to be doing is, in general, we need to increase the variability of our heart rate. Now, what does that mean? So when we are young adults, as opposed to comparing the heart rate variability of somebody who's an older person in their 60s, as we get older, our heart rate variability decreases. This happens with age. This also happens when we are in a stressful situation. Now, what does that mean actually? What does this increased heart rate and low heart rate variability mean? Basically, it means our body's ability to adapt. So if the heart rate variability is low, it means that we don't have that adaptability to adapt to different situations. We want that heart rate variability to be high. So this is a good measurable value where we can see how our breathing practice is affecting our heart rate variability. So so a lot of phones have apps, a lot of fitness trackers have this value where you can measure. So you can actually check and see just on a day-to-day basis, what is your heart rate variability just normally. Then you can practice certain breathing techniques, and there are many breathing techniques that one can do, and very simple breathing techniques that one can do. And you can see whether that changes your heart rate variability. You can also notice if you have a fitness tracker, and you can see the trend during the day. And then in that trend, you can see that, oh, I had this really stressful phone call or a stressful event during the day. I was trying to meet this deadline. And you will see that the heart rate variability would be very low during that time. So what you actually want to see is a person who practices breathing techniques frequently. Even in a stressful situation, they have high heart rate variability. So this is a really good non-invasive, which means something that you're not attaching yourself or pricking yourself with anything. You just have a measure where you can just measure either through your phone, or you can measure it by one of your fitness trackers. Now, at City Hospital, in the outpatient department, we do really encourage people not only to be attending the physiotherapy sessions, but to be graduating from the one-on-one physiotherapy and going on to a group session. A lot of the times people are so apprehensive and so nervous to go out into a session which would be either in a gym or in a center where they say that, oh, the teacher may not understand what my needs are. So we do offer this in our hospital, where the sessions are held by myself. Mostly the patients are, they're mostly from my colleagues have treated them, or I have treated these patients, and they have the ability. So this is kind of a bridging gap between the graduating from the one-on-one physiotherapy sessions, having these group sessions in a hospital setting where the patients can feel safe, secure, but still in a group setting before they go on their own individually. All right, and so this is the last slide where it's never too late to start yoga. That's again one of the things where people say I'm already in my 40s or my 50s, and it's definitely too late to start yoga. I can't even sit on the floor. And again, it's never too late to start. You just, as we said, we need a good teacher where you need to have that confidence and that safety, where you feel safe in your environment, and you will be given tools and ways where you can start your yoga journey. And that's it for me. There are a few articles that I've included over here that just talk about it. These are all scientific articles that support a lot of the facts that I have mentioned today. So that's it for me today, and we can open up to some questions. So, Veena,
Sure.
yeah.
We will request the audience, should you have any question, please post the questions on the Q&A section. We will read out for the doctor to answer the questions, please. So, Doc, the first question, can you shed some light on the Surya Namaskara? There is a lot of, on social medias on weight loss and Surya Namaskara. How does it work?
So weight loss is one of the things that people really focus on in when they think about yoga. They say that, oh, will it help me in weight loss? Um, I think that's quite a narrow view. So when we are talking about weight loss, there are so many aspects we need to think about. We need to think about movement. We need to think about our diet. We need to think about our lifestyle. So definitely adding yoga is one of the things that will aid you to get more discipline, to get a better quality of life. Yes, so I mean, definitely adding Surya Namaskars in a daily practice will add discipline. So in that respect, of course, it is something that must be added into your daily lifestyle. However, is it actually going to help in weight loss? Done individually, not. However, if you do it as a lifestyle change, yes. So what is recommended is that there are different styles of Surya Namaskar depending on the style of yoga that you practice. So what is recommended, at least to be doing 5 cycles of Surya Namaskar a day. So that's the minimum one should be doing. And of course, with good technique, mindfulness, breathing, because again, it has so many benefits as we spoke about. It's as we said, like a moving meditation, and increases your ability to breathe with each movement. And of course, you're moving in all different postures of the spine. You're bending forward, you're bending back, you're going down, you're using your arm strength. So a lot of different benefits on strength aspect and the mobility, and along with it, the breathing. So I hope I've answered that question for.
So going to the next question, Dr. Zareen, is what is the basic yoga to follow during long working hours to aid back and neck pain?
So during working hours, what is suggested, and this is not only for yoga, what is suggested is pause exercises. So it is advised that we should not be sitting for more than 20 to 30 minutes at a time. And every 20 to 30 minutes, you should be doing some sort of pause exercise. So the pause exercise can be actually anything. It can be yoga based. It can be just a regular movement. So in yoga, there are actually many postures that you can do in sitting. There are stretches that you can do for your neck. But basically, people sometimes they are under the misconception, if I have a really good chair, then I'll be fine. And if I don't move, it's fine. It's just my chair is really good. But you could have the best chair. You can be sitting in the, what they think is the best posture. But if you don't move out of that posture, it's not going to be so beneficial. So what is advised is every 20 to 30 minutes, getting up, even a simple stretch, bending backwards, holding the small of the back and having a small back bend, rounding the back. All of these postures, just doing one or two of those postures are really, really important. Now, having said that, there are some other studies that have shown that not only moving, so moving is one aspect. However, if every 20 to 30 minutes for 90 seconds, if you took a break from the screen and you did some breathing exercises, it's supposed to improve your productivity. And I've forgotten the percentage of what that study was saying, but it basically increases your productivity. So many benefits of just taking that little break, which could be just up to 60 to 90 seconds.
Understood.
Yeah.
Then the question is, what should be the average beats in 60 seconds? I'm not sure if that is a question related to yoga.
So,
Doc,
yes.
sorry, you were telling something. I interrupted.
Yes, so I'm not sure what the question is, but I think possibly I would answer this by saying what is the most advisable duration of the breathing technique that one should be doing. So normally when we are talking about breathing techniques, the breaths of 5 to 6 breaths a minute is the most advisable breathing technique that one should be doing in order to stimulate the calming part of your nervous system, which equates to approximately 5 breaths breathing in and 5 breaths breathing out. I shouldn't say 5 breaths, I mean 5 counts breathing in and 5 counts breathing out. So each breath is extending to 10 seconds. So if each breath is 10 seconds, that means in 1 minute, you will be doing 6 breaths. So a breath count of 5 to 6 breaths in a minute is supposed to be the most ideal breath that one should be taking to stimulate your parasympathetic system, which is that calming part of your nervous system. So I'm not sure whether I answered, whether this was the question, but maybe I can answer it a bit different if there's further clarification.
To the next question, Doc, could you please suggest a good meditation technique? Is counting numbers a good choice?
Yeah, so there are many meditation techniques, even as simple as, you're right, even as simple as counting backwards from 30, for example. That's a really good meditation technique. So literally just, again, what are we doing with the meditation technique? We are trying to focus on something. So if it means counting backwards from a particular number, really good. It's a really good way to focus your mind on something. So people use different techniques. You can count back. That's a really good individual technique to be doing. Some people use body scanning. So body scanning can be done by yourself, where you lie down on your back. You go through from your normally toes all the way to the head, and you think about each part of your body, whether you're relaxing it. And by the time you reach to your head, you would have addressed each part and each limb, thinking about whether you feel any tightness in that area and consciously trying to relax it. So body scanning is another method. Listening to even a story or a calming music or a certain frequency. And there are certain frequencies that really help with also with meditation, which is again focusing on that frequency and focusing your breath along with that frequency. So there are so many techniques of meditation, and it just depends on what techniques suit certain people, and you can play around with those techniques. Some, not every day you would want to do the same technique. You may not have time to do the same technique. You may not be in the environment to do that particular meditation technique. But certainly counting back is a really good, simple meditation technique where you can do a simple method counting back from either 20 to 30. So by the time you have counted back those counts, you would have focused on it and you will see that you are a lot calmer.
So, Doc, this is a quite lengthy question. I'll read out for you. I
Okay.
have been an athlete in my late teenage and early 20s. Since some time, I have joined gym. I usually work out for 1 hour and cool down in a proper way. I also make sure I do cardios for 2 days. I try to do yoga and meditate, but my body doesn't respond the way it should. For how many days I shall continue to do yoga so that I will feel it's showing some results on my body? And doctor, what could be the best yoga poses as a beginner?
So I'm not sure how old this individual is right now, but in general, body's adaptation time is approximately 3 months to 6 months. So that's how long you need to do any one activity in order to see the change. So even making changes in habits, behaviors, that's how long the body takes. So that it's part of your brain, which is your limbic system. That's how much changed time, turnover time, I would say, that your body needs. So and that's on the adaptation time of doing any one activity. So this is, again, I face this in my clinic a lot, where I may get a patient who is doing a certain activity that I have advised them to do, and they do it for a couple of weeks, and they say, you know what, I'm just seeing no benefit. How long do I need to do this in order to find any difference? And this is what it is that 2 weeks is too short. You need to be consistent 3 to 6 months in order to see any change. The other thing is consistency, very, very important. So if you are doing a particular activity, which is once a week or once in 2 weeks, that means, if you think about it, that means in a month you did it only 4 to 8 times. Or if you're taking 3 months, you're doing it only about like 12 times. That's just not enough. We have to be regular. So to be doing any activity which is small bouts, but often, is better than doing an activity, an exercise or yoga or any sort of active participation where you would be doing a big chunk of movement once a week. So small and often is more advisable. Now, as far as simple yoga postures, it's a bit hard to be saying online, because those are things that are very, very individual, and it depends so much on the person, their abilities, what their needs are. So that part is a bit difficult to answer. Okay, we can have the next
Yeah.
question.
Yeah. Due to continuous sitting, I'm having pain around the neck, shoulders, and radiating to the hands, and it's very painful. Is physiotherapy needed for this, and what can be done? Is there any home remedies?
So of course, being at the computer for extended periods of time, we often face these kind of symptoms. Obviously, as clinicians, we see this quite often. Um, I feel if it is something that one is not sure about, I would almost for certain suggest that they do get a professional opinion. When we are talking about home remedies, the biggest home remedy I would say is movement. So moving, getting out more often, going for regular walks, being out in nature, even this thing of grounding, which I haven't mentioned in my presentation because it doesn't directly apply to yoga, but in general, the concept of grounding is really important. We are wearing shoes all the time. We are walking on artificial surfaces. Um, our bodies inherently have charges, and just like a plug, we have the grounding wire of it. And why is that grounding wire there? Is so that your appliance doesn't fry in a way. So that's what our body needs, is we need to have that grounding, so our feet, our bare feet, touching a natural surface, which could be the beach, the grass, floor, gravel, but not an artificial surface, so that our bodies can ground those excess charges, as you may call it. And again, we don't hold those that much charge, but all this is, again, as I said, we have to do a little exposure every day, rather than thinking I'm going to be out for collect all my charges and be out for an extended period of time over the weekend. So of course, doing that is better than not doing anything, but the advice is always a little bit every day and consistency. That's I think, the main message here.
So the next question is about the chakras. Will yoga be able to unlock any of the 7 chakra? And if yes, which one and how?
Now, the concept of chakras is based on ancient yoga beliefs and techniques. In modern science, we don't have the concept of chakras. Ancient Chinese medicine, they also believe this concept of energy blockage, which is what chakras is. So there is no scientific evidence to support even the presence of chakras. However, in general, uh, just the concept of chakras and this unlocking the chakras is, again, this concept of having the kind of the blockage of energies that could be in certain parts of your body. All of this, regardless the solution and the approach to it, is movement, meditation, calming your nervous system down, reducing the amount of stress, having making changes in your lifestyle. So a lot of lifestyle related changes, rather than really focusing like I'm going to unlock a particular chakra. So things work more on a large, wholesome level, rather than thinking so small and so individual about a particular event that is happening in the body. So the approach has to be thinking more big and wide, rather than thinking about a narrow, like the view is more narrow, where you're thinking I'm just going to unlock that particular chakra, because even those events change in the body. Sometimes there could be different chakras that could be affected, and this is something that is changing depending on what your body is facing. So so I hope I've answered this question, but as I said, that in modern science, this is of course not support. This concept is not supported.
Going to the next question, if a person has high blood pressure, how
Mhm.
careful the person should be when performing yoga and breathing exercise?
Okay, so this obviously should be directed towards the cardiologist. So the cardiologist will be able to guide the patient depending on the extent of the high blood pressure. So definitely breathing exercises is something that is safe. That is one of the safest things that you can do. Um, and again, one of these things, if a person is not very confident, then having medical advice about how to get around it, that is that should be the case, where person doesn't do any kind of trial and error by themselves, where they are getting medical advice how they should be achieving their lifestyle change. So how to do the breathing technique. There are certain techniques that could be more suitable for a particular individual. So definitely, I think that these are such individual questions that they have to be addressed a little bit in a team effort. So with the cardiologist, with the physiotherapist together, so that again, those needs can be addressed a little bit on an individual basis. So generalized questions are quite difficult to answer, but the two safe things what one can do is breathing exercises, definitely really good. However, things like breath retention techniques may not be suitable. So this is what is what my advice is that there are certain techniques that may not be suitable. But on a general breathing techniques, going for a walk, doing a simple Surya Namaskar in the morning, simple postures would be advisable. But if one is not confident on how to progress and do it by themselves, it's again always under the supervision of a medical professional or under the guidance of a medical professional.
Yeah, so that was my next question, Doc, is it necessary when someone starts yoga to have a medical expert or a yoga expert to start with the session, or someone can just go to YouTube or any other social media to start with the yoga session?
My advice is always having some guidance. Of course, in traditional yoga practice, you would not go to different classes and different schools. Normally, in traditional yoga practice, there is a relationship between the teacher and the student, which is the guru and shishya. So that relationship is very special, where your teacher knows you, knows what your needs are, and individualizes the practice for you. And that's what should be the case. So I think a lot of the times, people get a bit disheartened with yoga because they do try to do it themselves. And for some reason, they may face certain obstacles, certain barriers, which could be either they feel that they pull something, or if they just don't feel right after they've done a certain practice. So I definitely feel that having some guidance, especially if they've not done any yoga before and they don't have their own practice, definitely advisable to get guidance, which could be as simple as a really good yoga teacher, or at the next level where you would do one step up and possibly go to a medical professional who has a background in yoga and could help them and advise them a bit better.
Doc, I think we have completed all the questions.
Okay.
Thank you so much.
Most welcome. It was a pleasure. I hope I was able to answer everybody's question. I'm not able to see anyone, but I hope that a lot of the misconceptions and a lot of doubts that people do have about yoga were cleared and clarified.
Sure. Thank you so
Yeah.
much, Doc. Hope
Thank
everyone
you.
enjoyed the session. Hope it was informative to you. We will look forward for any feedbacks you may have. Thank you so much. Have a nice day.
Thank you.